Now let's talk about giving breaths. To be effective, the victim airway must be open. Two methods for opening the airway are head tilt chin lift and jaw thrust. It is important to remember if you suspect a head or neck injury, use the jaw thrust maneuver to reduce neck and spine movement. If the jaw thrust does not open the airway, use the head tilt chin lift maneuver. When multiple rescuers are available, one rescuer can perform a jaw thrust, while another rescuer provides breaths with a bag mask device, as you can see in this image. The third rescuer will give chest compressions. Now let's talk about head tilt chin lift. Follow these steps. First, place one hand on the victim's forehead and push with your palm to tilt the head back. Next, place the fingers of the other hand under the bony part of the lower jaw, near the chin. Lift the jaw to bring the chin forward. Why we do this? When a victim is unresponsive, the tongue can block the upper airway. The head tilt chin lift maneuver lifts the tongue, relieving the airway obstruction. While doing this maneuver, we need to avoid pressing deeply into the soft tissues under the chin because this might block the airway. Additionally, we should not close the victim's mouth completely. When a head tilt chin lift doesn't work, or when we suspect a spinal injury, we should use the jaw thrust maneuver. Follow these steps. First, position yourself at the victim's head. Next, place one hand on each side of the victim's head. You must rest your elbows on the surface where the victim is lying. Place your fingers under the angle of the victim's lower jaw and lift both hands, displacing the jaw forward. If the victim's lips close, push the lower lip with your thumbs to open the lips. This may seem a little difficult, but in real life, it is actually not that difficult because the lower jaw, when person is unresponsive, the muscles they are relaxing and lower jaw is very easy to move. Now let's talk about barrier device. When giving breaths during CPR, standard precaution is to use a barrier device. Examples are pocket masks, which are preferred, and face shields. You can see both in this image. Rescuers should replace face shields with a pocket mask at the first opportunity. Infection from CPR is extremely unlikely. Only a few cases have been reported, but the USA Occupational Safety and Health Administration, which is OSHA, requires that healthcare workers use standard precautions when performing CPR in the workplace. Now let's talk about pocket masks. Pocket masks usually have a one-way valve that diverts exhaled air, blood, or bodily fluids away from the rescuer. The one-way valve allows the rescuer's breath to enter the victim's mouth and nose and diverts the victim's exhaled air away from the rescuer. Pocket masks are available in different sizes for adults, children, and infants. To use a pocket mask, position yourself at the victim's side. This position is ideal for one rescue CPR because you can give breaths and perform chest compressions without repositioning yourself. First, position yourself at the victim's side. Next, place the pocket mask on the victim's face using the bridge of the nose as a guide for correct positioning. Seal and press the pocket mask against the face. Using your hand that is closer to the top of the victim's head, place your index finger and thumb along the top edge of the mask. Then place the thumb of your other hand along the bottom edge of the mask. Place the remaining fingers of your second hand along the bony margin of the jaw and lift the jaw. Perform a head tilt chin lift to open the airway. While you lift the jaw, press firmly and completely around the outside edge of the mask to seal the pocket mask against the face. Deliver each breath over 1 second, enough to make the victim's chest rise. Resume chest compressions in less than 10 seconds. The air we breathe in contains about 21% oxygen. The air we breathe out contains about 17% of oxygen. This means that the air a rescuer gives out still contains plenty of oxygen to provide the victim with much needed oxygen. What about bag mask devices? This is providing a positive pressure ventilation to a victim who is either not breathing or not breathing normally. This device consists of a bag attached to a face mask. The bag can be self-inflating and you can use it with or without an oxygen supply. If it is not attached to oxygen, it provides about 21% oxygen from room air. Some bag mask devices can have a one-way valve too. Let's repeat one more time. For a proper fit, the mask should extend from the bridge of the nose to just above the lower edge of the chin, should cover the nose and mouth. Make sure the mask does not apply pressure to the eyes. All BLS providers should be able to use a bag mask device. First, position yourself directly above the victim's head. Place the mask on the victim's face using the bridge of the nose as a guide for correct positioning. Use the letter E and letter C clamp technique to hold the mask in place while you lift the jaw to hold the airway open. If you look at the picture, you can see that the pinky finger, ring finger, and middle finger, together they create letter E, and the thumb and second finger creates C letter. This is what we call E and C clamp technique. Then we will perform a head tilt. We will place the mask on the face with the narrow portion of the bridge of the nose. So the mask has wider portion and narrow portion. The narrow portion of the mask should be at the bridge of the nose. Use the thumb and index finger of one hand to make a C on the side of the mask, pressing the edge of the mask to the face. And as we said already, the remaining fingers should lift the angle of the jaw. There are 3 fingers for letter E. And these fingers will open the airway and press the face to the mask. We will squeeze the back with other hand while watching for chest rise. Deliver each breath over 1 second with or without the use of supplemental oxygen. When there are 2 rescuers, one rescuer will be positioned directly above the victim and will open the airway and will position the bag mask device. This rescuer should be very careful to not press too hard so the patient's jaw will not block the airway. Second rescuer, positioned at the victim's side, squeezes the bag. For the first rescuer, opening the airway and positioning the bag mask device is the same as we already discussed. It is the EC clamp technique, but with both hands. What about if we have a patient or a victim who has a stoma or tracheostomy tube or endotracheal tube? Actually, this makes our work easier. We can connect the bag mask device directly to the tracheostomy tube. And we should observe for chest to rise.